Back again to talk about prolotherapy and how it could be an option when it comes to treating your chronic pain, especially when it comes to tennis injuries. Our Dr. Ross Hauser and Dr. Timothy Special both are prolotherapists at Caring Medical Center. Good morning. Welcome back,
morning,
doctors.
Carly. Thanks for having us.
So yeah, we're talking about tennis this morning, which is another, again, we always talk about this, but Southwest Florida, such a, people live such an active lifestyle here. We love to be outside, and unfortunately, you guys are seeing a lot of tennis injuries too, right?
Absolutely.
So talk about what I guess maybe are the most common tennis injuries, or what are we going to talk about this morning?
Well, the thing of it is, Carly, we have this is the extensor. When people, they call tennis elbow, it's usually from a backhand with tennis, okay? And the little muscle that pops out here is called your extensor muscle and tendon, and it gets injured. And this is a picture of the elbow.
Okay.
And the elbow gets stretched, okay, from the force. But you can get tennis elbow or lateral epicondylitis from doing anything, from being a carpenter, from drinking coffee, from picking up your kids. So we want to emphasize that. Computer work.
Yeah.
Okay, so these are very common injuries, and prolotherapy is a natural injection therapy that Dr. Hauser and I have been doing for over 20 years. It's been around since the 1940s, that we inject joints with natural substances to rebuild our joints naturally. And they get strong and can get back to work, get back to their sports a lot sooner.
You know, we're talking about tennis this morning and certainly the elbow, but I believe we have a graphic of even the neck. But this is something that really, whether it's, tennis elbow or kind of what you like to say, anywhere where there's, joint instability, which is an example of here.
Carly, the hinges of the body are the ligaments. So like when your cabinet is injured, you have to tighten the hinge. You have to tighten the hinge, otherwise the cabinet's going to be wobbly. So in the human body, the hinge is actually the joint, and the screw are the ligaments. So you have to tighten the screw or tighten the ligaments. So the treatment that tightens the ligaments, that gets the ligaments strong, the tendons strong, the joint strong, which we just call a stable joint, is prolotherapy. So, and that's why the rate of success with prolotherapy is very high, because it strengthens the tissue.
Well, and let's talk about options that I think people have. I love that you guys are very honest in saying that this may not work for everybody. Right. I think maybe one of the most common options that people tend to go to is a cortisone shot or something, some kind of pain reliever right off the top. But I know you guys just want to say, hey, that could eventually cause more damage, unfortunately.
But most people are used to getting a cortisone shot. They go on their way, but it's masking the pain. There may be a place for it in some severe inflammatory cases, but for the most bread and butter cases, long term it's going to potentially cause degeneration of the tendon, and it's going to wear and tear that tendon, and that's not good.
So how do you know if prolotherapy, if you're going to be a good candidate? Again, you guys like to stress it may not be for everybody, but how do you know? What's the best way to figure out if this is going to work for you?
The thing of it is, Carly, that I think is important, many patients come up to us with x-rays and MRIs, and they're one-dimensional, okay? Well, we are, Dr. Hauser's a specialist in physical medicine, I'm an orthopedic physician. We're specialists using our hands. We examine the patients, we touch them, and it's a three-dimensional thing between our eyes and our hands. We're going to assess these joints.
See if it's loose.
If
in
it's
other words,
loose.
if you examine it and it's loose,
Right.
it's loose. You've got to tighten it. It's not going to be, giving a cortisone shot might reduce the swelling, but it's not going to tighten it. It's not going to screw it in. So the treatment to screw it in is prolotherapy.
And not even exercises. Exercises work once the joint is tightened. That's why they're going to go to physical therapy, and it's great. We're big proponents of physical medicine, but it's got to be after the joint is tightened.
Well, and I love, too, that you guys kind of take a picture of the whole body of what's going on. That's why you really, I like that you kind of said, hey, we like to touch you, feel what's going on. You kind of, it's this whole body kind of encompassing thing, isn't it, that you guys are doing?
Well, the thing of it is that people don't realize they may come in, Carly, like we just showed a picture of the neck, but they may come in with elbow pain, may have nothing to do with their elbow. It might be coming from their neck, it might be coming from their mid-back, the thoracic. So you need a skilled physician like Dr. Hauser or myself that is used to palpating tissues, and we can determine where the pain is coming from.
Well, something else that's going to be coming up here soon that I think people are going to be interested to hear about and see, if prolotherapy is going to be an option for them, is this talk that you have coming up. And invite everybody to this. What's your goal here?
May 27th, I'm going to give a talk at Pelican Marsh Community Center. So it'd be a great time to learn about prolotherapy, but also, to meet me and the staff, and then also just to get in, I'm happy to examine like Dr. Special has. I'll have some people come up and then I'll examine them, because most people don't understand like what joint instability is, like that looseness in the hinge. That's actually what causes most chronic pain. But
again, you encourage people just to find out more, to learn more, know your options. And for whatever reason, if you're not able to make it out to this talk, though, first thing to do, or maybe they want to find out sooner, call your office, look at your website. What would you recommend people do?
Yeah, have an appointment, you know, get an evaluation by Dr. Special or myself. And of course, our website, caringmedical.com, has almost every painful condition. So you could just search on the web site and see if prolotherapy is a good candidate.
All right, Dr. Hauser, Dr. Special, thank you so much for being
Thanks
here
for
this
having
morning.
us, Carl.
Thank
Really
you for helping
enjoyed
to
it.
educate Southwest Florida and again, just letting people know what their options are. And there are some relatively new ones I think people are going to be excited to learn about. Thank you both so much.
Thank you, Karen.
For more on Caring Medical Center, all you have to do is head to our website, foxborough morningblend.com. And we will have one last look at your Fox forecast and then be right back.